Hello again. I'm Dr. Aaron Brinen. I'm an assistant professor at Drexel's College of Medicine in the Department of Psychiatry, where I get the opportunity to direct a center where we disseminate and study and continue to develop recovery-oriented cognitive therapy for psychosis. One of the things that frequently comes up is this idea that CTR, as we call it, is not about symptoms, and we never address symptoms, and that's actually not accurate. And so I've been really excited to bring this one and really talk a little bit more about hallucinations, a little bit more of a deep dive than sometimes we get to do. And potentially, as we continue to go forward, we might come back to hallucinations and really think it through. So the purpose of today's talk is to review the psychological theory of voice hearing. We're going to really kind of look at it from a psychological standpoint versus a biological standpoint. That doesn't mean that there is no biological correlates. We're not denying biology. We're saying that the psychological theories underneath it might be really helpful. Also then to develop some strategies for interventions. And so some of the ways that we're going to talk about it today will be some of the ways that we don't always get to talk about during a workshop per se. What's not the purpose? We're not going to be talking about medicine. And we're also not going to be reviewing in great depth, like how do you do psychoeducation around voice hearing? And we're going to talk about why. It's an interesting thing. I always find voices really interesting because I'm not a psychiatrist. I'm not that kind of doctor. So if an individual who I have needs a change in medicine, the best I can do is go, I've got this really good friend. Her name's Dr. Irene Herford. She's really amazing. You should go see her, right? Hey, you should go see Dr. Kohler. He's really good at that. And then I send them out. So I always had to learn how to deal with all psychosis without any medicine. And then if somebody could prescribe for the individual I'm serving, that's all the better. And so I've never thought about psychotic experiences in the realm of how do we get medicine changed. And I think that that's actually a strength but it always became this empowering thing, because if you can't prescribe medicine, if you're on this call and you don't have the ability to prescribe medicine, now we have our role in it. It's not just let's send them to the prescribers. The other thing to remember is that there's a large portion of people who are not going to benefit from medicine, right? Maybe they benefit really minorly, but for the most part, medicine is not going to carry the day for them. And so that's another important thing for us to recognize, that we need our own way of helping individuals once we've identified that the medicine's probably not going to help, or before we've identified that the medicine's not going to help, because it's not an either-or approach. So let's start with this idea of what are hallucinations, right? Hallucinations are perceptions. They're perceptions that don't have an external stimulus. There are lots of different forms that they take. They're auditory, visual, tactile, olfactory, gustatory, but auditory is the most common of them. And it's an important thing to recognize that voice hearing is not unique to schizophrenia, right? And so I think that's an important thing to recognize, because I think there's a way in which we can think about this as this sign that our mind is broken. So we're going to really rethink it. And a lot of people nowadays have been exposed to things like the voice hearing movement, or there's these really nice movements out there that normalize the experience of voice hearing and not pathologizing them. Also, that voice hearing, you can see voice hearing in post-traumatic stress disorder and depression and bipolar disorder, and a lot of different disorders we can see this experience. So when we sit here and try to think about it, right, so we know that about 1% of the population has schizophrenia. But we also know is about 8 to 10% of the population hear voices on a regular basis without having any disorder whatsoever. Right? They're butchers, they're bakers, they're candlestick makers, and they just walk around the world and they hear a voice, right? They could be you, they could be I, you or me, and they hear voices. And it's an interesting thing because once they defined, through the DSM, once they defined all of these symptoms really well, and they started measuring, they started finding that there were a lot of people out in the world who were having these symptoms, but were not distressed, that they weren't having disorders, they were just having the symptoms. And this is actually not unique to voice hearing and psychotic experiences. You see it out in anxiety disorders. So people have panic attacks but don't have panic disorder. People have obsessions but they don't have OCD. People have compulsions, they don't have OCD. People have, intrusive worries, but they don't have generalized anxiety disorder. So we can see this in lots of different realms. It's not unique to schizophrenia and psychotic experiences. When you turn around and ask what percentage of the population has ever heard a voice, that number actually jumps up. The question isn't always asked really well, but it ranges between 60 and 80% of the normal population. And the interesting thing is that if you ask a similar question about obsessions, whether people have had intrusive, unwanted thoughts, images, or impulses, the numbers are really equivalent, right? So about 80% of people will report having had an unwanted thought, image, or impulse that causes anxiety in their life. And you might think about your own life. Just think about it right now. I can talk about many experiences of having, been somewhere and hearing a voice. I mean, I used to admit people I used to work admissions at a acute psychiatric hospital. And I'd work the midnight to 8 a.m. shift. And, usually, 2-3 times a month, I would just hear somebody call my name out in the hallway. And I'd sort of we had cameras and there was nobody there. My favorite example was I was at Horizon House, which is giving this very workshop, which is here in Philadelphia. And they had a fire drill in the middle of it. And I was on this very slide. I promise this is the truth. And we were all out on the street. And I heard the guy, a wonderful trainer and clinician named Stephen Burkett, who's there. And he called my name. We're all out on the street. And he calls my name and goes, "Hey, Aaron, I have a question." So I turn around and Stephen's in the middle of a conversation. I go, "What did you want, Stephen?" And he goes, "Nothing." I said, "You just called my name." He goes, "No, I didn't." And I was on this very slide. And so, we can all have these experiences. Sometimes people get very defensive, no, having hallucinations isn't normal. You can't have a hallucination. And one of the examples I actually use a couple not nice ones. But one of the ones that I give is, has anybody ever felt their cell phone vibrate in their pocket and they reach for their pocket and your cell phone's not there? Or, I mean, if you're a person who wears an Apple Watch, thank you, you say, your Apple Watch, and then all of a sudden it's not on, right? So you go to tap it to stop it from vibrating, it's not on. That's a hallucination. And if people really don't believe it, has anybody ever gone into a house or had somebody in their house have lice? Anybody ever do that? And then they just start itching? Or been at a picnic and seen ants and then you start kind of scratching yourself. These are all examples of hallucinations, right? Our brains are just like that. We think of our brain as this highly developed thing, but it's not like the new, iPhone. I always laugh that when they have a new iPhone come out, the guy goes, "We've redeveloped it from the inside out," right? Completely redeveloped it. That's not the human brain. Human brain is this patch job over, over millennia. And so as our brains have developed, we've never sort of undone these sort of needs for certainty. So under certain circumstances, most people would hear voices, right? So when we're talking about severe grief, trauma, sleep deprivation, solitary confinement, these are all times that could either increase the chance of hearing voices or make somebody who's not hearing voices hear voices. And so those are the times that our brains are most likely to do that. So voice hearing can actually be a very normal human experience. Many of us can do it. And the interesting thing that comes up when I talk about this in workshops is people go, "Oh, that 8 to 10% of the population, they must be nice, or they must be really friendly voices." And interestingly enough, that's not what they found. They didn't find that group of people didn't hear voices because they didn't have problems because the voices were nice. Some of them heard very nasty voices, or at times the voices could be really nasty. And so we're going to think about, why does that group of people not have problems and the 1% does have a problem. And it also, I once presented this to one of the individuals who I served, and he goes, "So wait, if I've got this right, Dr. Brinen, I just have to not be in this group. I have to be in this group, right? The 1% group. I need to be in the 8 to 10% group." And I'm like, "Well, that's a pretty good way." Yep, sure. I said, "If that works for you, great." And so it's a way of kind of thinking about how we all are on this continuum. So let's start thinking about, just out of like all of the trainings that we've had, what are the things that we always say, don't do this, it's going to make you hear voices, right? And, I like to sort of break it up into their sort of a couple things that can, there are a couple factors that when they all play together, they're going to increase the likelihood for our individuals hearing voices. Right. So think about, we all talk to people about the stress diathesis model, right? Or stress diathesis protective model, right? So when our individuals or we're more stressed, we're more likely to hear our voices, right? Makes sense. When we're isolated, we're more likely to hear our voices, right? When you're by yourself or staying away from people, you're more likely to hear your voices. When you're listening for your voices, you're more likely to hear your voices, right? So when you're paying attention to your voices, you're more likely to hear your voices. And then if we just sort of have a lot of time on our hands, we're more likely to hear our voices. Well, if we just think about it that way, right? If we think about voice hearing with this sort of formulation, then all of a sudden, voice hearing becomes sort of we're good at stress, right? Like that's low hanging fruit for us. Isolation, seeing how can we start getting people so that they're not isolating so much, that's pretty easy too. Attentional bias, like paying attention, things like mindfulness and stuff like that, we're pretty good at that. So what we're going to look at are what are the behavioral routines that are leading people to be stressed, isolated, and pay attention to their voices, and listening for their voices. Also, we want to look at sort of what beliefs or schema are activated for people that are having them focus and be stressed, isolated, or paying attention to things. These are all just sort of easy things, for us to focus in on. So this is where it starts feeling really cognitive behavioral, which is not a bad thing, or at least not for me. Here we go. Okay. So that's where we're going to get into the protocol, right? So if we think about things like stress and attention and isolation, activation, right? We've talked about this for a number of different meetings. That idea of activating people and getting them going, that's going to be really valuable in helping people to not be so distressed, and it's going to interfere with voice hearing. Right, same thing, aspirations, and then being more active. We're going to look at how all of those can interfere the voice hearing experience. People who've been in supervision with me have heard me say that I'm just not interested in hearing that the medicine needs to be changed when people's voices are worse or better. It's not because I don't believe that the medicine changing could be potentially helpful. If we're going to look at the things that the medicines probably do, interfering with voice hearing is probably sort of high on the list. The reason I'm not interested in it is that we basically absolve ourselves of any psychological model for voice hearing whatsoever. So we're going to start by thinking about the beliefs about the individual's voices, right? The top one is this idea that if I believe the voices control when they come and go, I'm going to be more likely to isolate. So we're going to actually go through each of these. The believing that the voices come and go as they please, believing that the voices are telling the truth, believing that the voices have the power to follow through on their threats. Then the final one, which actually has the least impact in dysfunction. In fact, they've really not found much connection between whether the voices are internal or external and dysfunction. That's just another belief. But we are going to talk about how we might work with that belief. So the first belief, right, the first problematic belief that we're going to talk about is if I believe that the voices come and go as they please, right, that I have no control over the voices, then I'm more likely to isolate. Because if you really think about it, if you heard a voice all the time, and it could come whenever it wanted to, and it was saying all kinds of horrible things about you, right? About the things it knows about you, that you're disgusting, that you smell, whatever it's telling you, right? If you believe that you have no control over it, you can't shut them up, you're more likely to isolate. Because if I heard a voice saying all kinds of, horrible things that it was going to force me to do, sexually, if I go out and I'm around people, I'm not going to want to be out in, walking around Philadelphia if I'm hearing this, thing talking all the time. And so what I do is I isolate. I avoid going out because I don't want to look like a fool. I don't want them to come in and then have me embarrass myself. So because I isolate, if I was going to ask you guys, if you isolate, do the voices go up or down? Right. They're going to be more likely to go up. And so I avoid going out. But when the voices come in, this is where we can really think about this cognitively. When I hear the voices again, it reinforces the idea that the voices can come and go as they please. Had I gone out, the voices would have come whenever they wanted to, and I would have been embarrassed. This belief that the voices come and go as they please is most associated. So people who hear voices and don't have a problem usually have the belief that they actually can exert some control over when they hear the voices and when they don't hear the voices, that they have control over the voices. And so if you were going to go after one belief, right, if you got one to go after and you're completely going in blind, this is the belief that you're going to want to go after, right? This is the first one that you're going to want to go after. The next one is that the voices are credible, right? That they're telling you the truth. And so if you think about it, a lot of the individuals that we serve hear voices saying stuff like the FBI's after you, they're coming to get you, the FBI's at your front door, those types of things, right? That they're coming to arrest you for, looking at things on the internet, these types of things. Also, sometimes the individuals we serve hear these voices saying things like, you're stupid, nobody likes you, everybody's talking about you. If I believe that the only reason I listen for them is because I believe that they're telling the truth. But if I expect to hear a voice, am I more likely or less likely to hear that voice? Right. You're more likely to hear a voice if you expect to hear it. So does anybody on this call listen for something they don't expect to hear? So if you don't expect to hear something, you don't listen for it. So if I continue to listen for the voices, it means that I expect to hear them. And so I listen for them because I believe that they're telling me the truth. So I need to monitor for it. Whether they're warning me, I'm going to listen for them. If I believe that they're trash talking me, think about sort of mean people who trash talk. We're always listening for them or going on Facebook or looking at what they're posting on Instagram, right? It's the worst part of the way our minds work. And yet we're more likely to do that. So I listen for the voice. But when I hear the voice, I have a sense of relief at having heard the warning, at having caught them, and so I'm ahead of them. But when you feel relief, there's no part of you that starts checking whether what they're saying is true or not true, credible or not credible. And so then I believe that the voices are credible. I hear the voice, I feel relief. That reinforces the idea that they're telling me the truth, so I continue to monitor them. So I end up in this really bad cycle around and around. The next one is actually a very interesting one because it's a belief that the voices have the power to follow through on their threats. If I believe that the voices have the power to follow through on their threats, then I need to comply with them. I need to comply with what they're telling me to do. So if the voice says, if you go and do this webinar, I'm going to kill, you're going to find their dead bodies when you leave that door. I would have sent the most lovely messages to all of you guys. And then Kat would have probably sent another lovely message afterwards. But I would not have done this webinar today if I thought that the voices were going to and hurt them. So the same is going to be true. So I comply, but when I comply, it reinforces the idea. Had I not done this, Had I not avoided the webinar, my kids would have been killed. And so it reinforces the idea that the voices have the power. On the flip side, I might engage in some sort of like compulsive type behavior or ritual to try to keep them safe, right? So I might say the Hail Mary 100 times. But think about it. If I'm speaking, I'm less likely to hear my voices. And so what I learn is not I can stop my voices and that they don't have power. What I learn is had I continued to, had I not said the Hail Mary 100 times over, my kids would have been killed. And so ultimately, it continues to reinforce the idea that the voices have the power. And so I continue to do things to appease the voices and their power. This belief is an interesting belief because it's most associated with people following through on command hallucinations. And so when we're talking about hallucinations, this is one that we're going to go after. So there was because I think when we start talking about command hallucinations, I always feel like it's like the third rail of of mental health treatment. The minute somebody says that they hear a voice telling them to kill somebody or to kill themselves, all bets are off. We're not, it's really hard to kind of stick with that. So in the UK, they did a really interesting study where they looked at a cognitive behavioral treatment that was really targeting the mechanism of that the voices have perceived power to inflict harm. And so it was called the command trial. And what they found, the interesting thing about this study was that at the end of treatment, individuals didn't necessarily stop hearing their voices, but they just didn't care. So the treatment really targeted the perceived power that the voices have to inflict harm on the voice hearer or to follow through on their threats. And so in that, once they helped an individual correct that belief, they didn't care so much when they heard the voices. If I hear somebody talking, they're just sort of, they're just spouting off. They're just sort of, running their mouth. So it wasn't quite so important anymore. The last belief that we're going to talk about is this idea that the voices are external, that they're real, that there are these real and out in the world. There are these people out in the world. Individuals who hold this belief sometimes might, after treatment's over, continue to try to prepare themselves. But here's the important thing about this one. It's the least associated with dysfunction. There's just no real good evidence that whether I believe the voices are real and out in the world or a part of my mind, that it causes dysfunction in a person's life. And here's the reason why this is an important thing to hold on to. If we think about the place that most people go when we're talking about voices first, the first intervention individuals get is around this idea that the voices are a symptom, that they're not real people out in the world. So if we were going to look at what is the belief people go after first, it's whether they're internal or external. And the problem is that you're going to get the least amount of benefit from it. In fact, if an individual buys into it, you might get a little bit of a benefit, right? If they buy into the fact of, oh, they're hallucinations, they're a symptom, they're a part of my mind, you might get a little benefit from it. If they don't buy into it, then we're into a power struggle where they go, no, they're not hallucinations, they're real people out in the world. And then then we go, well, we can agree to disagree. And the individual starts going, yeah, but you said they're a hallucination, and I'm telling you they're real. And so we end up in a little bit more of this power struggle when we really don't need it. It's not necessary to get into it. So if you're going to focus in on beliefs, control is probably your best bet, and then looking at credibility and power. Let's start moving away from whether they're a part of your mind or whether they're not a part of your mind. So when the main strategy that we're going to go after and this shouldn't be shocking because we're talking about cognitive therapy here, is correcting these individuals' underlying beliefs. Firstly, we're going to need to identify what the belief is, but once we've identified the belief, we then want individuals to learn through experience. Help individuals correct these beliefs using the experiences that we have with the individual for learning. And then ultimately, once they've changed their belief or even started to question their belief, we really need to change their behavioral responses. These beliefs are what are going to largely maintain the strength of the individual's voices, particularly credibility and power. Those are the ones that I find when person's doing lots of good stuff, but the voices are still maintained. I usually find in consultation that those individuals have a belief that the voices are telling the truth. So even if we're doing lots of good stuff, even if I've learned some wonderful wellness practices, I'm still listening for it to see if they're there, right? So we're going to talk firstly about the CTR protocol and exactly how we're going to tackle it as a part of the protocol. So one of the problems, if we go back to this formula that we talked about in the beginning, is problems with motivation and problems with connection. So if I'm not talking with people, I'm more likely to hear my voices, and I'm not going to start testing out what the voices are saying. Essentially, the only person I have a relationship with are these voices in my head. And they've been around a lot longer than any of you people on my webinar. So I'm more likely to trust them and believe them and listen to them. Also, if I'm not motivated to engage in things, that's what we're talking about with this isolation. And then if there's nothing else going on in my life, well, my attention's going to be going up there. My attention's going to be going to the voices because it's the only thing that's drawing my attention right now. And so we're going to go after the sense of motivation and connection, because as we start engaging in more things in our lives, we just get a little bit more distance from these experiences. So hallucinations and activation, right? We're going to find that we're going to use activation, and those are sort of all of those. It's activities, it's listening to, having conversations. Those are the things that we're going to do to sort of help individuals reduce or interfere with the hallucinations. Somebody who's hearing voices all the time, that's just going to take it down a couple notches. We also want to start establishing this idea that there are things that make the voices more and there are things that make the voices less. And particularly, we want to help individuals notice that talking makes them less. Which of these beliefs are we testing out when we have when individuals when we use with activation? What beliefs can we be testing out? Control is whether the voices come and go as they please, or whether I can control when they come and go. Credibility is that they're telling the truth. Power, that they have the power to follow through on their threats, or whether they're internal and external. So what we're looking at here is that activation really gives us a chance to test out. Control is definitely the front runner, right? If we listen to some music together and their voices are less, who chose to listen to the music together? And listen, every person who I serve, not every person, but a lot of the people I serve will go, well, you chose it. And I said, okay, but could you have said, I don't want to listen to music? No, that would have been rude. I said, it might have been rude, but could you choose to tell me no? And they're like, oh, I guess so. So if you chose to listen to the music and listen to the music made it stop, who stopped the voices? We stopped the voices, right? But who chose to listen to the music? I did. So if you chose to listen to the music and the voices stopped, then who really chose? I did, but we worked together. Absolutely. We're a team. I love it. But that makes sense that there are things you can do. Credibility and power are actually really interesting, because one of the things we can start doing is, particularly with power and credibility, is if we start establishing that we have the ability to shut them up, the voices up, then all of a sudden this question about how credible are they comes into play. Also, if we know what the voices are talking about, right? A lot of people kind of shy away from finding out, what exactly are your voices talking about? As we start to shy away from this idea of as we find out what the voices are talking about, we can do things together to test it out, and not necessarily to completely contradict that they're credible, but really just starting to chip away at it. So people who really love cognitive therapy, me included, thinking about that these are beliefs. And anytime you've ever done work around beliefs in cognitive therapy, beliefs are slow moving. It's like melting an iceberg. It's not like an automatic thought where right now it's credible, then it's not credible. It's really this long term, we want to chip away at it. So slow and steady wins the race in this type of work. So very cool. So when we're talking about activating of the adaptive mode, we're really talking about strategically increasing the individual's participation and motivation, and really doing these things that are interfering with the voice hearing experience. And so one of the things that can happen is if a person's beliefs aren't 100% around that the voices control when they come and go, but rather they're finding that it's not about the voices control when they come and go, but it might be about credibility or something else like that. If we can interfere with the voice hearing experience, we can even find, did they like having this like break from it? Would they like to have more break from it? And then we start entertaining the idea that maybe they're not telling the truth. Maybe they don't have your best, your best outcome at mind. If we're talking about things like being through telehealth and being on the internet, like media, the more interactive, the more stuff that you do, the better it's going to be, getting the individual involved. The goal of activation when we're talking about hallucinations is to have them really notice. Something stopped these voices, and that ain't bad. I like that. And then we're going to move into more of it. So then we're going to talk about sort of hallucinations and aspirations. Hallucinations and aspirations can really start to counter some of what the voices are saying, right? Establish that there might be a good reason for working on the voices more often. So if I decide that I want to teach my kids how to cook, right? Or I want to go spend more time with my kids, well, I don't want to be worried about the stuff that's in my head when I'm going to see my kids. So I'm going to do this hard work, or we're going to think about this stuff, or I'm going to deal with the fact that I might feel uncomfortable talking to you as a professional about voices. And so I might sort of bite that off. So aspirations give us the motivation to do this really hard work. Finally, when we're thinking about the protocol, action. Action allows us, and activity scheduling allows us to do this ongoing voice stopping, voice lessening. We can sort of schedule that into our day. It also gives us an opportunity to contradict what the voices are saying, and really check it out. The voices are saying, you're stupid, you can't read. If we schedule time to read every day, then let's see how right are the voices. And so we're gonna have an ongoing process of testing the beliefs. So let's talk a little bit about activity scheduling. In our normal workshops, we usually talk a lot about refocusing, but I want us to talk about using activity scheduling as a wonderful data collection source when we're talking about hallucinations. So activity scheduling is the systematic evaluation, increasing, and monitoring of the voice of your daily activity and of your schedule, right? So the purpose of it is, for us to learn that you get increased motivation and increased energy, right, when you're doing more. It also allows us to start collecting data around decreased psychosis, right? So when I'm doing more, I might be hearing my voices less. So I want us to think about activity scheduling as a way of doing it. And then we can also connect that there's some things that I do that my voices are less, and there's some things that I do that my voices are more. So what we can do is we can start to help somebody collect. This is actually from a book by Leslie Sokol and Marcy Fox. on cognitive behavioral therapy. I'll put a connection for Amazon, and I helped write the Psychosis chapter on it. And in it, we created this wonderful form, right? This sort of structured, So on one side, you're going to write down, a structured day, and then on the other side, you're going to write down an unstructured day. And so we can look over the last week. So is there any day that you got up and you had to do a bunch of stuff? And then hopefully the individual goes, yeah, it might be going to the psychiatrist. It might be helping my mom out. It might be cleaning up for, a holiday, right? There's any number of things. Any day where they did more. And then is there a day where you just stayed in your room and stared at the wall, right? And we want to kind of look at that. So we'll fill this out together, side by side. We're going to sort of fill these two things out and go through the day, all along the day. At the end of it, we want to figure out, okay, so on the day and then repeat back everything that you guys have just described. Which day did you hear the voices more? Which day did you hear the voices less? The day where you stared at your wall, or the day when you got up, went and saw the doctor, went to the diner with your mom, helped your mom with groceries, got annoyed because she took too long in the store, but ended up reading People magazine, right? So making it, they have to choose one, right? So which day was it more? And they go, what was the difference between the 2 days? And so we're setting up this new hypothesis by evaluating these 2 days. Then seeing, I wonder if we can would it be worth it to keep track of your days to see which days are you busier, which days are you less busy? And so then we're starting to evaluate, on the days that I'm doing more, I hear the voices less. On the days when I'm doing less, I hear the voices more. And so at that point, we even might start going, would it be worth it to start to try and sort of, sort of like the old ice cream eaters mantra, if a little's good, a lot's got to be better. And so helping them to start sort of, trying those things out over and over and over again. And that leads to the rationale for adding more into your schedule. And again, adding things into your schedule around, we want to add things into your schedule that are incompatible with hearing your voices, right? So that's going to be good, particularly for somebody who's leading with a lot of voice hearing. So the next sort of strategy that we're going to talk about is the rationale for refocusing, because when we talk about delusions, a lot of that is going to revolve around sort of stress reduction strategies. But when we're talking about hallucinations, we want to do refocusing. Gillian Haddock did a study, I think in the 80s, about this idea that if you teach individuals to distract themselves from their voices, they're more likely to become depressed. And it actually makes a lot of sense. If you think about sort of research on learned helplessness, which really, it's really good research, but it's horrible because essentially if you shock a dog and the dog has no ability to get away from the shock, they ultimately lay down and become depressed, even if they're becoming shocked. And so what you want to do is, what we're going to talk about is not having the individuals distract themselves, because when they distract themselves, they're essentially beholden to these voices that are torturing them. What we want individuals to do is we want to refocus, right? We're going to refocus away from this thing that is from our voices and focus ourselves into the things that we want to be doing, right? Aspirations, action, those things that are exciting in our lives. So any technique that can help individuals shift their focus away from these experiences are going to reduce the distress that they're experiencing, right? Stress, fear, frustration, anger, and other distressing emotions are going to block activity, right? Avoidance works in the short run, but in the long run, it maintains it. And remember, if I'm hearing my voices, it's pretty distressing. And when I'm distressed, I'm more likely to hear my voices. When I hear my voices, it's distressing, which makes me more likely to hear my voices, which is distressing. And so we're sort of stuck in this horrible, helpless cycle that we could be in. So activity is going to be the key to combating these experiences and ultimately achieving many of the aspirations. And so what we want to do is refocus away from the distressing experience and into action and aspirations. So we're not teaching somebody to to avoid, we're teaching somebody, or to distract themselves, we're teaching them to refocus into what's meaningful in their lives. So engagement is going to take lots of different forms, right? So it might include action, right? So going out and doing stuff with people, right? It might be walking, it might be doing some sort of art project, it might be gardening, any of those things that we can do alongside somebody. And through telehealth, that's going to be stuff that we could do, sharing screens, going for walks together. Communication, right? My mom was very clear to me when I was younger. Aaron, you can't talk and listen at the same time. And it's true for voice hearing too. You can't talk and listen at the same time. We can also give people some wonderful little techniques, right? Those simple gifts. If we're finding that they're really hearing their voices, we might say, that sounds really terrible. What if we could do something to stop the voices right now? And there's some nice techniques that we can use to help somebody interfere with it. And then talking about the aspirations, right? That's going to go a long way to interfering with the voice hearing experience. So there are lots of wonderful things that we can give people for refocusing: headphones, or listening to an iPod or an iPhone. On another time, we could talk about the technique look, point, name, singing, speaking under your breath, focused eating, right? So that's sort of, if anybody's done sort of mindfulness, like the raisin technique that people oftentimes do. It's a wonderful time because my attention's on there, and that's really helpful for visual hallucinations, is I'm drawing my attention to something that's in front of me and paying attention to it. Mindfulness, because it allows us to sort of attend to everything around us and not react to the experience. Counting backwards actually requires speaking out loud, but it also requires using your brain a little bit more. It's harder to count backwards than it is forwards. So that brings us to the question around psychoeducation, right? I would encourage people, and anybody who knows me really knows, I think psychoeducation is better used as a very specific intervention versus as a very specific intervention versus like a priori, we just give it to everybody. I'm actually going to launch a second poll right now, just to see, because we're coming up to the last of it. So I'm going to talk about this, but if people end up leaving, I'm going to launch this next poll. So fill it out as we go. So psychoeducation will be really helpful to go after really specific beliefs. Particularly, psychoeducation is helpful when people go, why is this thing happening at all? Right? Like, are these things symptoms? What could they possibly be? And so when people are asking those types of questions of what are they, what's going on, we can consider really specific interventions of saying, listen, a lot of people who I know, this is one way that they understand it. So it could be that they're real, but some people say that there's two little parts of your brain. One of them is responsible for talking a lot, for producing speech, and one of them's really responsible for listening. And some people believe that those two sections might be like really, really connected, like you have like extra connectors putting those things together. Right. And so they have like a silly name. One of them is called the Wernicke's area, and one of them calls Broca's area. They think that those are hyper connected. And so it could just be like a feedback loop in your brain. That's one possibility. It could also be that like our brain is really good at sort of picking up on stuff. Right. So if you've ever seen one of those motion sensor lights, those that just go off all the time, some people believe that it's sort of like, when we evolved to sort of be more likely to try to hear something. And so our brain just produces that sound sometimes. And then the other thing that we can also do is really help individuals normalize that. I've had a couple people, when I showed them the slide that I showed you, about 1% of the population has schizophrenia, but 8 to 10% of the population hear voices all the time and are totally fine. A lot of people liked that idea of going, oh, so my brain's not broken. I might just have this other thing going on. The key here is that individuals, if we play this card really hard, individuals can become really defensive and go, but no, they're not hallucinations. These are really, these are real people out in the world. And then we end up in that problem. And so every time we start getting closer to the voices, then they might start to sort of pull back a little bit more. So these are sort of ways into hallucinations. The purpose of today was to really review the beliefs about voices, and then really thinking about how we can use activity scheduling as a good way of starting that process of testing things out.
Dr. Brinen, I have a question.
Yeah.
Just with respect to the worldviews of a lot of folks that, especially in the religious worldview, the idea that they're speaking to God, or some other entity, angels, spirits, things of that sort, especially for those from more, I work with the Cambodian American community, and so a lot of them come from more traditional, I use the word traditional cultures, where talking to ancestry spirits and things of that sort, animistic frameworks, that's kind of part of that. So how would you speak to contextualizing the cultural components of voices and things of that sort?
That's a great question. That would be a good whole webinar. We should do that together, PJ. I think the question becomes functionality, right? I don't think we have to deny that actually gets into the internal external. When we get into that whole issue, then we're saying they're not real, they're not ancestors, they're not that. But if we look at functionality of the voices, of what are they doing? Listen, if I hear a voice saying, "You're doing the right thing, I'm really proud of you, you're great," lots of people hear voices. This is not exactly the same, but there was a woman I once met with, and she heard radio playing all the time, and it was Christian music, and she liked it. And so I said, "So what's the problem?" She goes, "You're not supposed to hear voices." I said, "Says who?" I said, "Listen, if it turns to death metal and you don't like it anymore, come back. Other than that, you're fine. Go off, take care of your grandkids, have fun." So I think if they start becoming problematic, where they're kind of they're demeaning them, they're commanding them to do things that we might not want them to do, that might not be really healthy, at that point, or if the person's spending a lot of time isolating and not engaging in valued, meaningful life in order to be ready to hear them. At that point, we can really talk about whatever religious cultural framework you're working within. There's usually a sense of do better in the world, not worse. Not, add to the world, don't take away.
Right.
Make people proud. Don't make people proud. Don't make them not proud. And so how do you do these things that are useful? What is the benefit to listening to them, right? Is it that you feel warm and connected? That sounds important. So let's make sure you keep hearing them so you feel warm and connected. How else do we help you feel connected? Because you shouldn't only have to feel connected with our spiritual life, right? But how do we feel connected all the time? Are you listening to it because you want to get their gut? So that's one part of it, is ultimately meeting that need in their life. Another one is, are they listening to their loved ones to see what are they supposed to do? And we can start evaluating, is there anything that these experiences have said to you that you wouldn't have done on your own? So for example, the person waits until they hear the voice saying, go volunteer and do charity. And so I might ask the person, was that like rocket science? Were you like completely surprised and went, "Oh, I never thought to go do volunteering work"? They're like, "Well, no, I would have done it anyway." So why are we waiting for the voices to tell you, why don't you do it? I know when my mother used to have to tell me to, whenever my mother used to have to tell me to empty the dishwasher, she was much less happier than when I emptied the dishwasher before she had to ask. So maybe ancestors, do you think ancestors would feel the same way? Now, I'm never at any point necessarily colluding. I'm just asking, would ancestors be happier if they had to come down and tell you to go do good things or not? And so starting to look at the function and can we get that without having to listen for them? But if the person just feels good because on occasion they hear good messages from the beyond, there's nothing bad about that. I think the other thing that comes up is people say, oh, the voices are really helpful. And the first question I ask is, great, I'm glad they're helpful. What are they saying to you? Because one of the things that can oftentimes happen is that the voices are saying things, but they might not be that helpful. They may not be helpful in the way that we feel it's helpful. So I'm going to use a pretty dramatic example of the voices might say, you're a burden on your family, you should kill yourself. Now, technically, those voices are being helpful. They're telling this person what they should do so they stop burdening their family. I don't know anybody on this call who'd be like, that's a good voice, we should listen to that one. So I want to know, how are they being helpful? On the other hand, I've heard voices that are really helpful. The best example, if you've never seen the video of Eleanor Longden, is fabulous. She tells this wonderful story about on her TED Talk about taking an exam. And during the exam, the voices told her to recheck a question, and she got it right. And so she jokes that she should split the degree with her voices. And so those voices are not that bad. So was that good? Was that helpful, Pise?
That's very helpful. Yeah, I appreciate I think looking at it from the functionality, because I think to normalize the experience is important. And I think to your point of saying and evaluating and assessing the functionality of it and its purpose, I think that's helpful.
Yeah, when a huge part of my work was in the state of Georgia, and I remember showing up in South. I flew so far south Georgia that we flew in and out of Tallahassee, Florida. So, they're like, we talked a lot about spirituality, and many of the people in some of the people in the very training were saying, no, I listen to my ancestors talk to me and things like that, which is good. So there's a question about, I'm curious about trying to keep our folks on a structured schedule right now. I have several experiencing increased symptoms because, okay. This is a really good question. So I think it always goes back to the, anytime somebody has told me that I should stay on a good schedule and work out all the time, a week, 2 weeks, 7 weeks go by, I haven't worked out at all, and I'm wearing my bigger suits, right? Absolutely. Anytime somebody tells me I should do it, I'm not doing it. So ultimately, we want individuals to see the benefit of engaging in these activities. And so that's really what we're going to do is, as we engage people, helping them notice, oh, it was more fun doing this thing than not doing this thing. And so that's really that's the strategy that we're going to go after over and over again. And so if all of a sudden looking at cats with lightsabers was fun, then when else are you going to, look on YouTube and try to find fun stuff? Or, oh, have you shared that with your mom? Do you think she would find that really funny? Oh, I think that she would find that funny. And so those are all of the ideas that we can help the individuals see the benefit of activity and doing it more. Oh, we went for a walk. Do you think that'd be fun other times? And so the key to activity scheduling has always been, back when Beck was using this for depression, is small impacts lead to larger impacts. So better for somebody to do one or two small things and increase it. But ultimately, the increasing is going to help them to establish, oh, when I did more, I felt better. And so then we go, so what do you think you should do? Would you like to feel better? And so the whole strategy of going after better. And so adding it in when they can. Also, if you're finding that people are having increased symptoms, it might be worth it to have little check-ins and texts or whatever your agency allows. just to see how's that going, what do you want to do, those types of things. So other questions? Everybody be well, be safe. Thank you so much. And again, my name is Dr. Aaron Brinen, and I will see you guys Monday for Grandiose Delusions. Take it easy.